Autologous stem cell transplant has created a very uh, steep benchmark for other therapies to follow. However, autologous stem cell transplant also has many quality of life and long-term challenges that patients may face, especially with second primary malignancies. I have no doubt that with CAR T cell therapy, we'd be able to get similar efficacy, but from a safety standpoint, still many things remain unknown. So we'll have to see how these randomized phase 3 trials evolve. And I do think that cellular therapies are the future, but we have to do our homework. And the other important question is, are the current cellular therapies the best cellular therapies that we are ever going to have in the field? I do hope that we even develop even more efficacious therapies with better safety profiles for the future. So, I think the field will evolve. Eventually, these novel CAR T cell therapies are going to replace the existing high-dose melphalan with stem cell rescue model. But I think it's kind of futuristic to think about this at the moment. We still need to prove the point in these phase 3 trials.